Hi, my name is Christine Sperdute, and in this presentation, we will be discussing my mixed methods research prospectus. Does grit impact long-term weight maintenance? This convergent parallel mixed method study had two specific aims. First, to identify a relationship between grit score and long-term weight maintenance outcomes, and secondly, to examine how grit score may affect the experience of long-term weight maintenance. Just a little bit of background information to help you understand why this topic of long-term weight maintenance is so important. My interest with this topic really began as a health coach, and a lot of my members and my clients that I worked with, the majority of them were trying to lose weight or maintain weight, and it's really difficult for people to do. And as you can see, 86% of Americans are expected to be overweight or obese by 2030. And obesity is linked to so many different health risks, including high blood pressure, heart disease, diabetes, depression, and so many more. With that being said, it's probably not a surprise that we spend an enormous amount of money on obesity related disease. In fact, it's estimated that about $344 billion are spent each year on obesity related disease. And like I mentioned, as a health coach, the majority of my clients were trying to lose weight, and about 49.1% of US adults reported trying to lose weight in the last 12 months. However, of these people, those who were successful at losing weight, only 36.5% maintained their new weight long term. So you can see there's a really big difference in how many people are successful at maintaining this new weight. While there have been a lot of studies specifically surrounding weight loss and weight maintenance, a lot of them focus mainly on diet composition or exercise frequency, intensity, duration, and not many of them have focused on the role of grit in weight maintenance or weight loss even. But there have been a couple studies that have focused on the role of grit in health behaviors more generally. The first that we're going to talk about is the one by Traino et al. In 2019, which found that there were higher levels of grit associated with better healthcare management skills and a higher quality of life. So this is really good, just kind of introductory information, and we can connect that grit may be associated with better health management skills. So things like weight maintenance, physical activity, eating healthy foods. Reed et al. In 2013 found that there were significant differences in the frequency of physical activity behaviors between those who were pre-contemplative or contemplative in the trans-theoretical model stage of change versus those who were in a preparation, action, or the maintenance stage of change. So this may show that grit may not be required to initiate a behavior, but it might be extremely important in the action and the maintenance stages of a behavior. So specifically thinking about weight loss, this study leads us to believe that grit might be more important for somebody who is actively losing weight and trying to maintain weight than somebody who's getting ready to start that initial weight loss journey. In 2015, Reed showed that exercisers reported significantly higher grit scores compared to conscientiousness, which is another psychological concept that shares many of the same characteristics as grit. So with all of the background information and those studies that focus specifically on grit and health behaviors, research has shown that grit may positively impact the action and maintenance phases of behavior change and is associated with characteristics already known to increase the likelihood of successful weight maintenance. So things like goal setting, social support, and motivation. Again, the maintenance phase of weight management is extremely difficult. So thinking back to that background information, about 36% of people are successful at maintaining weight long term. So ways to make this phase less burdensome should absolutely be explored. And this study would connect the concept of grit, behavior change, and weight maintenance. It would integrate the concept of grit into already existing weight maintenance programs and help to increase that number of people who are able to successfully maintain weight long term. So now diving into the methods, the first thing I want to talk about is the sampling method used. Purposeful homogeneous sampling was used for this study, and it's widely used in qualitative research for selection of specific individuals that relate back to that phenomenon of interest. So, again, this phenomenon of interest is that weight maintenance. And although there are a lot of different sampling strategies that we could have used, this was the most appropriate for this study. So just some demographic information. All of the subjects are between 18 and 65 years old. They are all UPMC employees that are English speaking, and all of these subjects must have previously participated in an initial UPMC weight loss intervention program. So I work for UPMC Health Plan. I'm a supervisor of on-site health coaches, and we do have a very standardized 9-week weight loss program that covers things like social support, tracking, physical activity, nutrition, goal setting, relapse, and how to get back on track. And in addition, we do a 30, 90, and 180-day follow-up with the member. And so these participants would be recruited from a health coach after the completion of that 180-day follow-up. So we know that this person has been trying to lose weight and has been trying to maintain that new weight for 6 months. So that puts them into that long-term weight maintenance phase that we're really looking at. So we're not capturing individuals in the initiation of a diet or an exercise plan, but again, we're really getting them in that weight maintenance stage. UPMC Institutional Review Board approval and California University of Pennsylvania IRB approval will be required, and all participants will sign a consent form and will be required to participate in the study. They'll also sign a consent form that the interviews, which we'll talk about a little bit later, will be audio recorded, and that data will be collected and used in reporting. A convergent parallel mixed method study design was used for this prospectus, and this consists of a qualitative and a quantitative study portion. So you can see a correlational study and a phenomenological study. And both forms of data would be collected simultaneously, but the data sets would be analyzed separately and merged to compare and verify against each other. The correlational design of the study would be used to determine the degree to which a relationship exists between grit score and percentage weight lost and weight maintained over a 6-month period. So it's important to note that correlation doesn't imply causation, and that's a real limitation of the study design. However, again, there are not a ton of studies looking at this yet specifically, so this would be a really good baseline relationship to identify before diving into deeper research. The phenomenological study would be used to address the attitudes and behaviors surrounding long-term weight maintenance through the lens of grit. Data for this study would be collected in several different ways. First, eligible participants would complete a validated 12-item grit questionnaire developed by Duckworth in 2007. Validity of this scale was determined using 6 studies to ensure predictive validity, consensual validity, and retest stability. And the grit scale is an efficient measure of passion and perseverance for long-term goals. This grit scale would be given on paper and pen in a private room, and subjects would be asked to answer the questions on the scale honestly and told that all information would be kept confidential. Grit scores can range from 1 to 5, 1 being not at all gritty and 5 being extremely gritty. So that would be one component of our data. The second component of our data would be a calculation of percent body weight lost at 180 days post initial intervention. So again, we're getting these subjects at the 6-month post intervention mark. So we're really looking at that long-term weight maintenance, and we're using a percentage of weight loss because clinically significant weight loss is defined as losing at least 10% of initial weight. So again, we want to look at clinically significant outcomes as well. So the weight loss where we're seeing reduction in all of those health risks that we talked about earlier. And then lastly, the researcher would conduct one audio recorded face-to-face semi-structured interview with each participant to explore the phenomenon of weight maintenance. The interview would cover everything from barriers to successful weight maintenance, factors the individuals believed help them with weight maintenance, goal setting, social support, self efficacy, and more, as all of these were identified as characteristics of grit. An interview guide would be developed prior to any interviews and examined by another expert in the field to ensure it's appropriate and it's getting at the information that we really want to know for this study. The interviews would be audio recorded with a microphone, and the researcher would take brief notes by hand. All interviews would be conducted in a private office at UPMC Health Plan. After data was collected, it would be analyzed. So again, we have two different types of data here, qualitative and quantitative. And our quantitative data would be analyzed using SPSS, and a simple linear regression would be conducted to determine if a relationship exists between grit score and percentage of weight lost and maintained at that 6-month post-intervention mark. In addition, a correlation coefficient would be calculated, and with this value, a value close to +1 indicates a strong positive correlation, where a value close to -1 would indicate a strong negative correlation. A value near 0 would show that these two variables are not related. Our qualitative data, on the other hand, would be analyzed a little bit differently. So first, audio recorded interviews would be transcribed by software and organized into meaningful groups based on the individual's grit score and their percentage weight loss. So again, we're looking at how grit score may impact this experience. So we're going to separate this data out into meaningful groups. The data will then be reviewed and coded, and important themes will be identified. And we're going to aim to collapse this data into about 5 to 7 main themes. It would be very important when reporting this data that we report it visually and also narratively. And the researcher will conduct a discussion summarizing and interpreting major themes, results, and of course the implications of the findings for future research. Member checking, triangulation, and an external audit will be completed to validate the accuracy of these findings. In conclusion, this convergent parallel mixed method study aims to identify a relationship between grit score and long-term weight maintenance outcomes, and also to examine how grit may impact the long-term weight maintenance experience. And this study could be very important for future research in terms of lowering healthcare costs, reducing healthcare risks, and increasing the likelihood of successful weight maintenance in individuals who, again, lose that initial weight. Thank you for listening, and please let me know if you have any questions. Here are a list of references used in this presentation.